Okay, good afternoon po sa lahat. Now we go to the constitutional lung and heart weakness. Tongue signs associated with constitutional weakness of the lungs. Two vertical parallel cracks in the anterior third of the tongue are indicative of an inherited disposition towards weakness of the lungs. If a parent or a grandparent had contracted or died of tuberculosis, these tongue signs may appear 1 or 2 generations later. In my experience, these cracks suggest the frequent appearance of chronic illness of the respiratory tract, for example, bronchial asthma. They point to a tendency towards both lung qi and yin deficiency. In these cases, the diagnosis of the tongue provides important information about the constitution of the patient. When such cracks are evident, the practitioner must inquire about the family history. A positive answer indicates a constitutional weakness of the lungs, which must be taken into consideration when determining the treatment plan. Okay. So here we have a case of a male, 37 years old. The tongue is pale red, slightly wet. So there's a spleen qi deficiency. There's also 2 parallel oblique cracks in the anterior third. So, na-observe po natin, mabuti. So, there's a constitutional lung yin and qi deficiency. The symptoms is palpitation with or without exertion, tendency to catch colds, painful knees, and fatigue. Sa Western diagnosis, there is a cardiac arrhythmia, Reiter's disease. Sa background to disease, family disposition towards lung weakness, grandmother died of tuberculosis, overwork, and emotional problems. Next case is a male, 36 years old. The tongue is pale red, swollen, and presence of slight teeth marks. So there's a spleen qi deficiency, accumulation of dampness. There's 1 oblique vertical crack in the anterior third. So this indicates a constitutional lung yin and qi deficiency. Patient symptoms is runny nose, sneezing fits, pressure in the chest, occasional difficult breathing, soft stools, and fatigue. Sa Western diagnosis, there is allergic rhinitis. Sa background to disease, family history of respiratory illness and overwork. Special tongue signs. Swelling in the anterior third of the tongue is indicative of retention of phlegm in the lungs. Very often, these tongue signs will appear in conjunction with the pale tongue body. The damp phlegm in such cases is associated with underlying spleen qi deficiency. Fluids accumulate and form phlegm if the spleen qi is too weak to transform and transport solids and liquids. The phlegm is retained in the lungs where it interferes with the qi mechanism and led to coughing with copious white and easily expectorated sputum. This may show up in the tongue as a white, slippery coating. The swelling in the anterior third of the tongue reflects the chronic nature of this pathology. If this sign appear in conjunction with red tongue body and a yellow greasy coating, it is an indication that the phlegm coexists with heat. The patient will then be coughing up yellow viscous sputum. Next case is a female, 41 years old. The tongue is pale and swollen, so there's a spleen qi deficiency, accumulation of dampness. There's also a swollen, it is also swollen in the anterior third, so there's a retention of damp phlegm in the lungs. There's also a whitish thin coating, which is normal. The patient symptoms, coughing with copious white mucus, tendency to catch colds, and exhaustion. So Western diagnosis, there is a chronic bronchitis, several miscarriages, and sa background to disease, overwork, and irregular eating habits. Sa case history, Mrs. H, 41 years old, worked as a pharmacist. She complained of a chronic fatigue. She was always busy and never took any time off to rest or relax. In her spare time, she and her husband renovated an old farmhouse, which was physically exhausting. The dusty environment contributed to the onset of Mrs. H. chronic cough. She had a tendency to catch cold, which always exacerbated the cough. She coughed up copious amount of white sputum. During this time, the patient became pregnant but had a miscarriage in her 7th week of pregnancy. Her diet was very irregular and she preferred cold or had hardly cooked foods. Her tongue was pale and especially swollen in the anterior third. Her pulse was submerged and frail. Sa analysis, the pale swollen tongue and the submerged frail pulse indicate deficiency of Qi and blood. In this patient, spleen Qi deficiency resulted from chronic overwork, lack of rest, and inappropriate diet. The miscarriage was a result of the Qi and blood becoming so weakened that the fetus was undernourished. The accumulation of phlegm in the lungs was reflected in constant expectoration and in the swelling of anterior third of the tongue. The presence of phlegm disrupted the descent of lung Qi, which led to the chronic cough. However, the underlying pathology is the spleen Qi deficiency, which over the long term led to the formation of phlegm. The spleen and lung Qi deficiency are responsible for the chronic fatigue. With the help of Chinese herbs, the cough was cleared and the patient has given birth to a healthy child. Okay? So discussion, swelling in the anterior third of the tongue is an indication of accumulation of phlegm in the lungs. Patients with this tongue sign will often suffer from illness affecting the respiratory tract. Coughing with expectoration of copious amount of sputum is typical of phlegm obstructing the lungs. Dietary changes should be advised and phlegm producing food should be avoided. Next case is a female 37 years old. The tongue is pale red, slightly swollen. So there's a spleen Qi deficiency, accumulation of dampness. There's also a swollen. It is also swollen in the anterior third. So retention of damp phlegm in the lungs. There's also a depression in the anterior third. So gathering Qi and lung Qi deficiency. Patient symptoms is feeling of tightness in the chest, tendency to catch cold, severe exhaustion, cold hands, and soft stools. There's none sa Western diagnosis and sa background to disease, overwork. Next patient is a female 48 years old. The tongue is pale red, which is presence of slight spleen Qi deficiency, swollen in the anterior third, so there's a retention of damp phlegm in the lungs. There's red points of the anterior third, so there's acute externally contracted wind heat. There's also a yellow slippery coating at the root. So there's a retention of damp heat in the lower burner. Patient symptoms is sore throat, dry cough, joint pain, weight gain, inability to sleep through the night. So Western diagnosis, there is acute cold, ovarian cancer, hypothyroidism. Sa background to disease, condition followed chemotherapy. Next case is a female 36 years old. So, yung tongue ng patient is pale. So, there's a presence of spleen Qi deficiency. It is also swollen in the anterior third. So, there's retention of phlegm in the lungs. And there's a white wet coating. So, there's acute externally contracted wind cold. Patient symptoms is cough with profuse white mucus. There's a tendency towards chronic bronchitis, catches colds easily. There's fatigue, profuse menstrual bleeding. So Western diagnosis, there is iron deficiency anemia, acute cold, and chronic bronchitis. So background to disease, there is sadness and grief after the death of mother. There's repeated use of antibiotics and overwork. Next case is a female 52 years old. The patient's tongue is pale red, with slight teeth marks on the side. So there's a spleen-chi deficiency. It is also swollen in the anterior third. So there's a retention of phlegm in the lungs and presence of red points in the anterior third. So the remaining pathogenic heat lingering in the lungs. There's also a yellow greasy coating in the posterior third. So there's a retention of damp heat in the lower burner. Patient symptoms is cough with profuse white frothy mucus, phlegm in the throat, pressure in the sinuses, frequent blood-tinged sputum, loss of sense of smell and taste after a cold. So Western diagnosis, there's presence of acute cystitis, pulmonary emphysema, bronchial asthma. Sa background to disease, family disposition towards illness of the respiratory tract and overwork. Heart gene deficiency occurs frequently in older people. Symptoms caused by this deficiency tend to be sleeping disorders, dry mouth, especially at night, and increased anxiety. The diminished strength of kidney yin, which is less able to nourish the heart yin, is physiologically normal in old age. The heart is linked to the element fire and has a close affinity to heat. As the cooling calming qualities of yin diminish, heat tends to rise faster. Heart yin deficiency can also develop in young people and is related to long-standing emotional problems. Constant excitement and agitation, stress, hectic lifestyle, drug abuse, or a constitutional weakness of the heart. It is important to closely inspect the shape and color of the tip of the tongue, as this reflects the state of the heart energies. A red swollen tip is indicative of flaring up of heat from deficiency of the heart. A red cracked tip or a long midline crack on a red and peeled tongue may reflect heart yin deficiency. A general deficiency of blood commonly found in women can lead to heart blood deficiency. The heart depends on adequate supply of blood to support its function of storing the spirit. When the heart is deprived of this nourishment, the patient will present with anxiety and/or insomnia. In general, heart blood and heart yin deficiency share some common symptoms. Meron siyang palpitation, anxiety, forgetfulness, and dream-disturbed sleep. However, the two can be distinguished by their effect on sleep and differences in tongue signs. In the case of blood deficiency, the patient may find it difficult to fall asleep, but once asleep, she will continue to sleep through the night. So, yan po yung sa blood deficiency. In addition, because the blood that reaches the tongue is inadequate, the tongue and tongue body color will be pale. By contrast, in the case of heart yin deficiency, the patient will wake up frequently during the night and be very restless. Also, the tongue body color tends to be red. Okay, so that's the difference between the heart yin and heart blood deficiency. Over the long term, heart blood deficiency may lead to heat from deficiency of the heart. Because blood is part of yin, over time, heart blood deficiency can also affect the heart yin. Both processes can be seen when the tongue tip is red and the tongue body is pale. Heart blood deficiency with flaring heat from deficiency. Or there is a pathological change in the shape of the tip. The symptoms of heat or fire from deficiency of the heart, irritability, palpitation with anxiety, insomnia, restlessness, and a dry mouth and throat are more pronounced in heart yin deficiency than in heart blood deficiency. In the former case, the tongue body will be red with a strongly discolored red tip. If there may be, in addition to a peeled coating, a long vertical midline crack. Okay? In the case of heart-yang deficiency, the tongue body will be pale, swollen, and wet. Besides fatigue and exhaustion, the patient will often experience severe shortness of breath upon exertion. If kidney yang deficiency accompanies this condition, there will also be sensation of cold in the body. Next, we go to the tongue signs associated with constitutional weakness of the heart. So, long tongues. A long pale red or pale tongue that is big but within the normal range points to a strong constitution. As a rule, tongues tend to be narrow or thin. If the tongue is very pointed towards the tip and of a reddish color, may indicate a constitutional weakness of the heart. If the tongue body is reddish or red and shows reddish areas on the tongue body surface, it is an indication of the presence of internal heat. Heat in the body not only dries the body fluids, it also moves qi and blood vigorously. This movement of qi and blood causes the tongue to be extended so that it will protrude farther from the mouth than normal. The opposite mechanism obtains for short and pale tongues. Cold slows down flow of qi and blood and is contracting effect manifest in a short, open contracted tongue body. A long reddish tongue often appears with a firm tongue body. Long-standing heat depletes fluid and yin, which in general causes hardness, firmness, and dryness of the tongue body. On the other hand, accumulation of yin dampness is responsible for a swollen and soft tongue body. The diagnosis of heat in the heart is confirmed by the appearance of a long tongue with a very red tip or red points on the tip. It is not surprising, therefore, to find a long tongue which is often seen as an indication of heat in the body in conjunction with the reddish or red tongue body. The degree of narrowness of the tongue body reflects the extent of injury to the body fluids and yin. In general, a long reddish and especially firm tongue indicates a tendency to yin deficiency. Further, since yin deficiency often gives rise to heat from deficiency, which readily affects the heart, a long tongue may especially point to an imbalance in the fire pace. Okay? So another case of a female, 22 years old. The tongue is reddish, very long. So there's a constitutional heat in the heart and presence of slightly red edges. So there's a heat in the liver and yellow greasy coating in the middle and posterior third. So there's a retention of damp heat in the middle and lower burner. Patient symptoms is raised bleeding, skin lesions, strong itchiness, soft stools, inability to fall asleep. So Western diagnosis, lichen simplex and eczematous dermatitis. Sa background to disease, caffeine abuse and prostration. Next patient is a female, 39 years old. There's a pale red, long. So there's a constitutional heat in the heart, drawn in sides in the anterior third. So there's an onset of heart yin deficiency. There's a slight reddening of the tip, which curled down tip. Okay, so there's a heart blood deficiency. Symptoms of the patient is headache, stomach pain with stress, inability to fall asleep, inner tension, inability to bear any emotional pressure, and nervousness. Sa Western diagnosis, uterine fibroids, and background to disease, repressed emotions. Next patient is a female, 34 years old. The tongue is pale red, which is normal, and there's a long pointed shape. So there's a heat in the heart, long pointed shape, constitutional weakness of the heart, red tip, so there's heat in the heart and vertical crack in the center. So there's phlegm fire in the stomach. Patient's symptom is acute stomach pain, hypochondriac pain, heartburn, insomnia, restlessness, ravenous, hunger. Sa Western diagnosis, there's none. And sa background to disease, irregular lifestyle, caffeine, and cannabis abuse. Thank you for your attention.